Hello, everyone, and welcome to another community conversation episode. Today, I have a very special guest here with me. It's Dr. Liliana. Hello.
Hi, how are you?
Thank you. Thank you so much for being here with us.
You're welcome.
Today, we're going to be discussing post-COVID-19 blood clots and preventing fatality. It is still a very current and important topic to discuss. So I would jump right in and ask you a question that a lot of people want to know, and that is that we are seeing more and more evidence of relationships between blood clots and COVID-19. Is there a way, and how can we prevent those blood clots?
Yeah, so this is generally we prevent blood clots because there is people, for example, that also are taking contraceptive, which also increase the blood clots, or when you are traveling long hours in the plane. So basically what you can do to prevent it is to walk around, to move every 1 to 2 hours. Also, quit smoking is very important. It will lower your risk of blood clots very much. Also, try to wear loose and comfortable clothes that don't block the circulation of the blood. Avoid taking alcohol and also medications that make you sleepy, because then maybe you will be less active. So to prevent, it's basically being active. And in case, for example, you have to do a flight or something like this, you can use also the compression stockings to help and try to keep your feet active. And even when you go on the car for a long time or the train, so basically everything that requires that you are immobilized, then you should be careful with that. Yeah.
Okay, those are great tips, honestly, and I think a lot of our listeners are going to benefit from that. But also, speaking of blood clots, how can someone spot those blood clots if they contract COVID or if they are recovering from COVID-19?
Yeah. So it depends where the blood clot will lodge. So, for example, if it lodged in the leg, you would start feeling pain in the leg is getting swollen. Also, if it's superficial, sometimes you would feel like the leg is warm and it shows some redness as well. So these are for the legs, how you can spot. If the blood clot goes to the lungs, then suddenly you can start feeling like shortness of breath, difficulty breathing, chest pain while breathing. You can also start coughing, and inclusively coughing up blood. It can happen. And also you can feel that your heart starts beating faster. Mm-hmm. If the blood clots, for example, lodge in your brain, then your symptoms would be like a stroke. So you could have a very strong headache with some neurological symptoms, like, for example, your vision gets blurry, or you start feeling that one limb it's weak, or that your face gets asymmetrical or with a weird speech, something like this. So basically that is the symptoms that you should look out, and if you have any of those, you should immediately call 911 for assistance. Here it's a different number.
Yeah.
Yes. But yeah, to go to the emergency.
Yeah, definitely. No, those sound like it could get pretty serious symptoms that I haven't heard of before. But now the current hot topic is about the importance of D-dimer testing. So what is exactly the importance of D-dimer testing in preventing fatalities?
So D-dimer is a substance in the blood, and that it's often increased in people that have blood clots. Mm-hmm. So basically, when a COVID patient is admitted to the hospital, the doctor would run a D-dimer, and this will help to know how severe is the disease. So they use it to assess the severity of disease. In the outpatient, so in the clinic setting, we normally don't ask the D-dimer. There's no need. Only if the patient has any abnormal symptoms or signs, that it was what I described before. So if there is a suspicion that maybe the patient is suffering for a blood clot, then we would ask. But routinely, like these patients that just stay at home and have mild symptoms, we are not asking for it, just more the patients that need admission to the hospital.
Okay, so in those special cases, then
or if you have symptoms,
Okay, and I also want to know what is the current situation in the UAE? Like, is it regarding coronavirus? Is it improving, or is it getting worse, or is it getting somewhere? What's the current situation?
So according to the statistics of the government, it's improving. The cases are going down, and we are one of the countries that has a higher rate of vaccination. And I think this is helping us. Although the variant set all the world a bit back, but I think since the vaccine it's still effective, and with the measures that the government has put in place, at this point the situation seems under control, and that is improving day by day.
Well, here's hoping. I know that vaccination is really important, and that people should encourage each other to do that in order to prevent the spread and finally get this over with as soon as possible.
Yes.
Well, that's about the time we have today. I want to thank you so much for being our guest.
You're welcome.
And I wish you a lovely day.
You too.
If you want to be part of Community Conversations, make sure you email info@seeyouaround.app. For all things community, events and lifestyle, download the See You Around community app now.